Hi, I'm Dr. Anndrea Hatcher from Olive Branch Park Veterinary Clinic, and this is my pug, Inspector Clouseau. I'm going to talk about separation anxiety. Say you come home from work after a long day and you open the door into a blizzard. You blink and you realize the inside of your home is actually blanketed with upholstery stuffing. Your rat terrier, Velcro Boy, leaps up from the remains of your couch and greets you enthusiastically. Or you come home from your weekly grocery store trip with your arms full of bags. You step into the house and are overwhelmed by the odor of urine and feces. Your Labrador mix, Clingy, jumps up with you with her front paws gooey with yuck. Velcro Boy and Clingy, who by the way barks constantly while you are gone, making you a candidate for the least favorite neighbor award, aren't behaving this way because they are angry at you for leaving them alone. Some animals, like people, can suffer from mental disease due to an imbalance of brain chemicals. Velcro Boy and Clingy have separation anxiety. They are destructive, loud, or messy because they are so abnormally distressed when you are away from them. Separation anxiety is most often seen in dogs 2 years old and younger, and in dogs 9 years old and older. It is thought that older dogs may start losing their sight and hearing and become more nervous when they aren't in close proximity to their owners. Separation anxiety is different than having a dog that isn't housebroken, a puppy chewing on furniture because he is teething, or a Labrador retriever that needs more exercise and is frantically bored. The separation anxiety behaviors only take place when the dog is away from his owner. So, maybe your dog does actually need Prozac. There are 2 veterinary drugs currently labeled for use for separation anxiety in dogs, Clomicalm and Reconcile. They each have generic forms available, clomipramine and fluoxetine. In dogs, these drugs work by changing the brain chemistry to decrease their fear and anxiety and increase their ability to learn. Treating separation anxiety requires not only medication, but training. The highlights of the training include, number 1, pay attention to your anxious dog for 30 minutes before you leave the house. Right before you go, calmly give your dog a special treat, like a Kong filled with peanut butter, to distract him while you calmly leave the house. Number 2, when you get home, ignore your dog until he is calm. Don't punish him if he damaged things or went to the bathroom in the house while you were gone. Putting him in a dog crate while you are gone might be a good idea to keep him from eating your grandmother's hope chest. Number 3, periodically go through your leaving routine, like picking up your keys, but don't leave while still ignoring your dog. Separation anxiety medication and training won't cure all dogs, but generally are pretty successful. Not all dogs are candidates for these drugs, and some medications will interact with them. Wow, shouldn't I read those last 2 sentences very quickly and in a monotone and get paid a lot by a pharmaceutical company?